Welcome back to Talk of the Town. Well, thankfully it is spring, the time of year when the trees start blooming and the pollen is released, so we start thinking about spring allergies, and we are joined by our news partner from the Medicine Shop in Monona, and we've got Eric Hewitt. How are you today?
I'm good, thank you.
Glad to have you back.
Thanks for having me.
Yeah, you're gonna demystify the spring allergies for us a little bit here. Talk a little bit about some of the causes of seasonal allergies, if you would.
Yeah, I mean, I think unfortunately a lot of people are experiencing that these days, and it's probably only going to get worse as the weeks go on and we continue to have things, bud and all that kind of stuff. But basically what the cause of the seasonal allergies is actually your immune system kind of responding to those things that you're allergic to. When it gets into your body, your immune system thinks, well, this is a threat and I need to attack it. And then it sets a series of events in motion to kind of get rid of that threat because of the allergies. So it's really an immune system response to something in the air. So. And
what do you think is causing it? What are the most common kinds of seasonal allergies?
The most common that you see are going to be pollens, like you had mentioned before, and those can be pollens from trees, from grasses, from weeds. Those are the big spring seasonal allergies. So when you start to see those buds on the trees and the grass is starting to grow, although it's really nice and pretty and green, it also comes with the allergen effect as well.
Yeah, it sure does. And a lot of people suffer from allergies, like you mentioned, and people are starting to look for treatment options. So this is where your expertise is greatly appreciated.
Sure.
Talk to us about some of these options for treatments and what do you think the best course of action is?
Sure. Well, I think there's a bunch of different options out there. There's your typical antihistamines. Those are things like Allegra, Claritin, or Zyrtec. Those are the brand names, and a lot of times pharmacies will have store versions of those as well. You also have nasal sprays, and some of those have come out over the counter recently, so you no longer have to go to the doctor to get a prescription for those. And also things like neti pots, which help to kind of flush out the sinuses, can also be really beneficial, as well as eye drops, depending on where the symptoms are occurring, that kind of thing.
So there's actually a lot of options.
There are.
So that's a good thing for people who are suffering. But the tough thing then is, how do you know what's right, which one you should be using? How do we know that?
And that's where people like myself, your pharmacists, really, I think, come into play. Especially with so many over-the-counter options. It's always good to check with your pharmacist before you decide to do anything, because even though they're over-the-counter doesn't necessarily mean that they're safe. And so what that means is that, have a conversation with your pharmacist, make sure they know what you're on, and they can steer you in the right direction. Maybe something would be better for certain symptoms compared to others. And again, if you have certain medications that you're taking, the pharmacist would know that and say, hey, you should probably steer clear of this and go with something more along these lines.
Absolutely, and utilize folks such as yourself, your pharmacists, because they are a wealth of knowledge. We've talked about this before, but often an underutilized resource. And I think it's important to remember, you can just walk right into the medicine shop and have somebody that has a full understanding of all these options and choices.
That's very true. And at the medicine shop especially, we love to get out from behind the counter and, kind of consult with our patients and really inform them, of what their options are, and making sure that they continue to, stay healthy and have as good a life during the spring season as possible.
Absolutely. And I want to touch on the allergy shot. I've heard of this from other folks. Now, is this something that is available, and tell us about it?
A lot of insurance companies, obviously, again, always check with your insurance company before jumping into something like that, and talk with your doctor about that. But for people that have severe allergies, and we're not talking, you have some itchy, watery eyes, runny nose, that kind of thing. Sometimes seasonal allergies can knock people down for days and weeks, and even out of work and things like that. Those types of things would require the potential for allergy shots. And what that does is it provides a little bit of the allergen into the system to kind of desensitize the immune system to not want to attack that so harshly. And it can kind of, over time, kind of lessen the reaction to those allergens.
Absolutely. Well, thank you for kind of demystifying this a little bit for us and
Sure.
just letting us know how many options there are available. We appreciate that because this is certainly the time of year. I'm one of them who definitely is affected. So
Me as well, unfortunately.
yeah, I mean,
so
I think a lot of
healthcare
folks-
professionals are not
you're not
immune to it.
Yeah, absolutely. Well, if you're not right by these guys, they're on Monona Drive, worth a little bit of extra travel time to speak with Eric or somebody in his fabulous staff. So go see these guys, Medicine Shop of Monona, our fabulous news partner here on Talk of the Town. Thanks, Eric.
Thank you.
Thanks also to all of our guests for joining us. Thank you for watching, and please join us next time.